The next slot, 30 minutes to Fianna Fáil, Deputy Jack Chambers, James Brown, John Lahart. 30 minutes sharing. Deputy Chambers, you have 10 minutes.
Thanks, Cahirla. I'm pleased to be able to speak in this bill on behalf of Fianna Fáil with Deputy James Brown, spokesperson on mental health, and in my own role as party spokesperson on drugs and tackling the country's crippling drug problem. It is an area in need of major reform in terms of our approach. Every day we hear stories of individuals, families and communities around the country devastated by drugs. I welcome the renewed focus in this area and also look forward to the development of the new National Drug Strategy, which will shape our policies in trying to tackle this issue in the coming years. I am pleased to be able to support this bill, which addresses a problem which is currently causing huge issues across this country. It is something Fianna Fáil has been raising for some time. In May, the Fianna Fáil leader, Deputy Micheál Martin, highlighted how the main issue on the streets concerns tablets, and specifically these so-called Z drugs. I also welcome the Government's decision to appoint a dedicated Minister for Drugs, as proposed by Fianna Fáil, and look forward to working with Minister Byrne into the future, and I wish you well in your new role, Minister. I think today's discussion highlights very clearly how we as legislators need to stay on top of a constantly evolving environment where clever, ruthless drug dealers use every loophole, every grey area, every opportunity they can to intimidate and prey on vulnerable people and make their profits off victims of drugs. It is regrettable that it has taken the recent and ongoing spate of gang-related deaths to focus minds on this issue, but I am glad this legislation has been fast-tracked. We as legislators must be proactive and aggressive in tackling the huge international criminal empires. People in all communities countrywide will know of the devastating heroin and narcotics causes on a daily basis. But actually, addiction to the specific substance in this bill is second only to alcohol abuse in Ireland. This shows the scale and prevalence of these drugs. The drugs being discussed today, which are of course legally available through prescription, are causing just as much harm in the hands of drug dealers. Some of these have been given colourful monikers like Clockwork Orange, Zimmos, Blues and Yellows. But don't be fooled. There's nothing harmless about the damage these drugs are ravaging, the devastating health effects, the cost on our health services, the relationships destroyed, the lives ruined. We're banning these drugs because they are harmful and because the bodies trying to tackle the problem like community groups in the inner city and the Gardaí, have sought this action to enable us to properly tackle criminal gangs. We should also be mindful of the doctors and nurses in our emergency departments who are on the front line dealing with the very real impact of what happens when drugs like these are taken. Clockwork Orange, for example, has been linked with several deaths here. Former users of the drug have also been to the fore in highlighting the dangers of these types of drug. One former user said, and I quote, he said, "When you take it, you don't want to move, you don't want to talk. It's hard enough keeping your eyes concentrating on what's going on around you. Then when you don't have it, it's just a total different person. The whole paranoia sets in, anxiety. It makes you feel very sick." And they concluded that way. Cahirla, this move is not an attack on problem drug takers and those who have addiction problems. I think that should be made very clear. There should be absolutely no confusion or obfuscation by deputies in this House on this point. This is about empowering agencies to be able to target the gangs who are controlling the supply and sale of these drugs at every level. And like much of our drugs problem, this is happening at every level. We might like to trick ourselves into believing this is a problem, and often in the media reports we see only socially and economically deprived areas being labelled with a drugs issue. Yes, the problem is profound in those areas. Indeed, just this week, a report from the Clondalkin Drugs Task Force, led by Dr Aileen O'Gorman, found that drug-related harms consistently clusters in communities marked by poverty and social inequality. The research found that this situation was allowed to develop by successive governments' policies and year-on-year funding cuts. These communities simply cannot survive if this continues. But it's far too simple a narrative to think drug problems are simply confined to these communities. Such thinking will only lead to the escalation of the drug problem if it is allowed to fester. The drug dealers and gangs who are supplying heroin, and feeding off addictions in the city centre are the very same drug dealers who are dealing to recreational, intermittent users who work on a daily basis but decide to consume whatever their drug of choice is on a Friday or Saturday night. The substance may be different, but the result is the same. The victims in our city centres and in the more deprived areas may be a more obvious symbol to point to the drug scourge here, but the task for us all should be to make all people realise that every joint that is rolled, every line of cocaine that is snorted, every pill swallowed in a nightclub is money directly into the pockets of criminals, the very same criminals who are now committing murders on a near weekly basis at this stage. Whether you are rolling a joint or rolling a €20 note, you are contributing to the carnage and the terror being meted out. Trying to get this point across and trying to make this connection is important, and it has to be highlighted. More equally important, however, is the need to develop proper treatment, proper rehabilitation and proper therapeutic and aftercare services. No progress can be made in this area until these services are in place. As work gets underway on the new national drug strategy, more emphasis than ever before needs to be placed on prevention. This should start with our younger people. Greater emphasis needs to be placed on the teaching of SPAG in schools and informing children on drugs and the dangers of them. Former users, as well as healthcare professionals and law enforcement agencies, I believe, have a lot to offer in this regard and can play an important role in educating and preventing young people going down the road of drugs. Many resources should be committed to the local drugs task forces who are dealing with the issues on the front line every day. A large national public health awareness campaign should be a key component of the next national drug strategy. Programmes like needle exchanges and methadone clinics serve a purpose also, but we should look at ways of improving such approaches to the drug-taking problem. One option in this area is to legislate for the use of Suboxone, a methadone alternative which helps to reduce the symptoms of opioid dependency. Suboxone is less addictive and harder to abuse, making it safer for those with drug problems. Although expensive, a pilot programme of 80 users here has delivered promising results and has been recommended by the HSE steering group. It has been proven particularly successful in treating people who become addicted to over-the-counter drugs due to the stigma associated with methadone clinics, and they often go untreated. All the while their addiction grows and consumes them, their work, their relationships, their family, their whole life. A study by the British Medical Journal found buprenorphine, the main component in Suboxone, is 6 times safer than methadone with regard to overdose. And I'd welcome clarity and an update from the Minister on whether she intends to legislate for Suboxone and to introduce it so our primary care centres can improve the lives of many people who face drug addiction. The Department of Health has also given its approval for Suboxone, and I believe the House should work collectively to ensure that the drug is dispensed. Equally, we should push for more GPs to embrace such replacement mechanisms, moving away from methadone clinics and delivering treatments at community level. The next drug strategy should also ensure greater levels of research are undertaken to ensure we compile a database of information and statistics to get a full, encompassing picture of the situation today. It's only with this information that we can properly and broadly tackle the problem. Ultimately, we should implement a national substance misuse strategy to respond to the shifts in patterns of drug use and to include the growing crisis with alcohol abuse. This will ensure equity service provision in both urban and rural communities, assessment of needs at community level, implementation of evidence-based interventions and measurement of outcomes. It is also important to consider the work and report of the Justice Committee under Deputy David Stanton, now Minister, in the last Dáil term. Considerable research and work went into producing a report which examined the Portuguese model of drugs, and I look forward to examining this report further and other issues related to tackling the drugs problem during this Dáil's term on the Justice Committee and in my role as the spokesperson on drugs. It's clear the collective will is there. We now need to show a blend of compassion and understanding, determination and ruthlessness to effectively tackle the huge drugs problem in Ireland. Thank you.